Hey, everybody, welcome back to the Prime Pediatric Podcast. It is my honor to have Dr. Amy Spoelstra here today. I am so excited to have you here, Amy. Amy is one of my lifelong friends. She's an amazing person. Dr. Amy, how are you?
Hey, Dr. Skip, it's always good to see your face and your bow tie and be a part of anything you're doing. So I'm great. It's great to see you. Thanks for having me.
I love that you're here. You guys listening to this podcast over the last 3 years, you know, in the last year, I've become focus certified. You know that I've been doing a lot of work with Dr. Spoelstra. And if you haven't had a chance to hear Dr. Amy speak on Focus Academy, on NDD, on neurodeflections, now is the time. And after you hear today, you're probably all going to want to jump in and be a part of her amazing program. I can tell you that having it here in our office, doing this work, Dr. Amy's lifelong work, like this is her work. Has been nothing but an absolute honor and a blessing that she has certified us. And yes, I went and took the program. I did the classes. She just didn't say, hey, Skip, take the certification. I'll give it to you. I had to do the work and it was wonderful. I learned so much. So Dr. Amy, welcome. Love you. Give us a quick synopsis as to how my docs can get a hold of you, anything about you right away in the beginning so they know who you are.
Yeah, well, first of all, congratulations on continually saying my last name correctly, which is you deserve a gold star of some sort for that. I still have to think about how to spell it sometimes. So Spoelstra. Yeah, I live in Coeur d'Alene, Idaho. I've been practicing. I'm a Sherman grad. I was just at Lyceum last weekend. That was great. The center of the chiropractic, principled universe. And we have a few other places going to be expanding that in Scotland, which is awesome. But Sherman grad, been practicing almost 15 years. Started right out of the gate, cash practice, pediatric, brain development. And I literally opened my practice within a week of graduating. So we just were like, let's do this. And we'll just be poor until we're not poor anymore. And we'll help people and we'll do it the way we want to do it. And actually it grew really quickly because when you know how to lead with the message, with the brain, with making a case for what you do, it really differentiates you. And it really makes teaching chiropractic pretty easy because it makes it easy to understand. And that's that right there. We have the Focus Academy where we certify docs with the Brain Blossom at Home program that once you're through the certification, you can offer in your office. But that's where we teach doctors this work and specifically on supporting typical development, understanding why chiropractic is really important to support typical brain development when we're talking about pediatrics and just processing in general when we're talking about adults and stress response. But really, it's all about finding the simplicity by understanding more, by leaning in, learning more about brain development, about deflected brain development, about behavioral learning, socialization challenges, diagnosed, and here's the kicker, undiagnosed. It's not just about chasing the symptom. It's not just about chasing a diagnosis. It's not about doing all the other things. It's about understanding what subluxation looks like, what that does to the nervous system, how to find that, how to communicate that, and then understanding the consequences of subluxation, altered neurological communication function, the consequences of that on the developing brain and just the brain in general, and what to do, what to include in your clinical rationale, in your understanding, in your communication, in your exams. That's what Focus is all about.
And I think that it's a very amazing, well-encompassing program. And like you said, it's finding the simplicity through complexity. It's keeping things as simple as possible, both in the chiropractor's brain and the parent's brain. Because if you're trying to communicate and your brain's full of garbage and a couple, I don't mean it like that, but basically a jumbled mess, it's going to come out as a jumbled mess to the parent. And then the parent's going to be just as confused as when they walked into your office. And working with massive amounts of NDD kids, kids with neurodeflective disorders, kids with all sorts of things across the spectrum, you know as well as I do, most of our parents aren't living in a simple life anymore. Their heads aren't simply simplified in nice, easy compartments because they've been given so much information.
Yeah.
They don't know how to sort through the garbage to figure out the right route. And I think that's what's made you amazing. Now, I know that inside your program, I want to talk about the Watch and Wonder series, because I think Watch and Wonder is one of the coolest things that every doc should really understand. Can you kind of start out at primitives and work your way up, Dr. Spoelstra, and just clue us all in on how this works? Because I haven't seen this presented anywhere else in chiropractic. I haven't seen it presented really anywhere else in clinical neurology fields, which
Yep.
makes this work pretty phenomenal. Can you enlighten us?
Yeah, absolutely. So the premise of the focus approach, brain blossom approach, is really understanding more about typical brain development and processing. And in order to understand what altered neurological function, subluxation, inflammation, infections, blah, 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 all these things when it comes to like biomed stuff, all these things, right? Which so often we get distracted by as chiropractors. If we want to understand what the consequences of some of those stressors and stress response that happens inside the nervous system, the consequences of that are in creating maybe behavioral learning socialization challenges, mental health challenges, and that we first have to understand, what does typical development look like? What is the typical trajectory of development look like? And then we can start understanding what altered development looks like. And then we can start putting the pieces together of, okay, so how do I know if a subluxation is at play here? And how do I put those pieces together so that we can really, really simply, and I always say, make the case for ourselves first, right? Doctors, first us, first we have to understand, and then we can communicate that to others, right? And so the watch and wonder hierarchy, there's 8 hierarchies that we teach in the certification series. 8. Now, the first hierarchy, the first 2, and we teach this in the online prerequisite learning modules before the live training of the certification series. But in the first 2 hierarchies are really what you're hanging your hat on in practice. You have to understand the others. They help you have a more expansive understanding. But the first 2 are just like, this is the bread and butter right here. And the first one is called the watch and wonder hierarchy. And this is this right here. We know that the brain is not fully developed at birth. We all know that. And one of my favorite things to say is like, listen, this isn't just like, let's look inside chiropractic. Let's look at the research happening inside chiropractic. Although, yes, we need more. And yes, we contribute to that. Absolutely. But we have to be able to be brave enough and intelligent enough, which we are, to look outside of chiropractic as well, use our deductive reasoning to put the pieces together. But first, look outside of chiropractic and say, hey, what do we all know? What do we all agree on? And what we know is that the brain is not fully developed at birth. We have to move through a trajectory of development. We know that it kind of goes like bottom up, back to front, inside out, right to left, ending in that prefrontal cortex, that whole brain processing. We know that. But we also know that at different stages of development, at different stages of that architectural build of the brain, which is influenced by, of course, sensory input of all different forms, including proprioceptive input, including all that mechanoreceptive input around the base of the skull and the upper cervical region, of course. And if that's altered, it alters input, which can alter growth. So we know we have to have all this input. We know the brain has to move through a trajectory of development. And we also know that at different stages of development, we have different tools that we acquire to process our world. Yep. Starting with primitive reflexes. Here's the watch and wonder hierarchy. Starting with primitive reflexes, as we continue to grow, we start to develop our big muscles, so gross motor, and then our smaller muscles, fine motor. We become in that second year of life more sophisticated in our auditory processing, right? And then we start to develop in that same time frame more sophistication in our ability to point our eyes at things in an accurate and stable way, right? Eye movement, extraocular muscle function, and then leading to our final destination of using our whole brain and really active in that frontal lobe, our ability to have higher cognition, executive function. We call this visual cognition in our world, our ability to see the future, the past, process in a cognitively flexible way. So we understand that at different stages of that development of the brain, we have different tools. Now, the tools that we use, let's say a child is still really in the movement, gross motor, fine motor, and movement touch realm. They're really primarily processing in a movement tactile way, movement touch kind of way. They're using that primary tool to process their world. Well, what we know is that their behavior is going to manifest that. We're going to observe that they move their bodies more. They put things in their mouth. They are developing that skill set based on where they are in development. Mm-hmm. Now, we could spend, and we do in the certification series, like 4 days on this one hierarchy. There's a lot to understand there. But the basic idea here is that we do not have a kid who's having a behavioral learning socialization challenge is not just merely stuck in a gas pedal brake situation. They're not just looked at as having a behavior, a learning, a socialization challenge, and they're like a bad kid or bad parenting or bad teaching or whatever. We understand that the behavior is in fact a window to the brain. What we have to be able to develop our brain-based lens to watch and wonder, observe a behavior, understand what that tells us about what tools a child may be using primarily, not that they aren't using the others, but primarily to process their world, and bounce that, marry that together with our very simple clinical exam, looking at primitive reflexes, gross motor, fine motor, eye movements, auditory verbalization, visual cognitive function, very simply, quick little 10, 15-minute exam, so that we can say, okay, this child's behavior makes sense based on what tools they're using, based on where they are in development or gaps that may be there. Now, what do we know that impacts brain development? What do we know that impacts brain function? Well, we know that altered neurological function, altered proprioception, altered balance in the autonomic nervous system. We know that that has been shown, again, looking outside of chiropractic, that has been shown to impact the brain.
Everywhere.
So we put those things together. And we teach you how to put those things together. And it's really important. And this is the last point I kind of want to make on this here. I know that's a lot, but really we help you find the simplicity of this in our work. So you can stay in the chiropractic lane, but understand a little more about the brain. The thing is that other professions right now, other professions are looking at these brain-based approaches. Psychologists, educators, traditional medical community, they are looking at the brain. They are publishing books and research with titles that say things like brain-based parenting, brain and body parenting. They are looking at that. And if we don't step up and enter and lead this conversation, because that's really, they're talking about chiropractic.
They're talking about what we do.
They're talking about what we do, but we have the tools to impact the state of the nervous system and communication within the nervous system. We just have to know a little more about what that looks like and the consequences of the brain and observable behavior, so we can tie it together and we can enter and lead the conversation. Not so we can be, doing all this other stuff in our practice, but so that we can make the case clearly, understandably, effectively in why chiropractors need to be the leaders in this brain-based movement that, guys, it's already happening. Like
it is. And the biggest thing is that we have that nobody else has is the ability to restore normal.
That's right.
And restore normalcy, not the miracles, but restore the normalcy, because the normalcy is key. And the funny thing is Dr. Spoelstra is here talking about all this. And what it is that you guys, like, here's the thing, in the last 10 years, chiropractic has kind of made its massive impact in the world. If you've noticed that we're becoming more and more mainstream, more and more commonality, and it's true. But the reason why is because everybody else is finally stumbling on the shit we actually have talked about for over 70 years. You go back to Stevenson's work with the normal complete cycle, you go back to all of this stuff, and we've been talking about it for decades. It's just that now your more mainstream forms of healthcare are finally catching on to this and understanding it. It's no different than 4 years ago when they started understanding that the gut is completely controlled by the central nervous system. It's the same thing. So my question to everybody out there is okay, now is the time to get off your asses and start talking about this stuff. And you need to start making videos about it. You need to start learning stuff like Dr. Spoelstra is talking about and keeping it simple, but also being able to look at, there's a phrase there that Dr. Amy talks about that you all need to understand, and that all symptoms are windows into brain development. They're windows into dysfunction versus normal function. And if you don't do a functional neurological exam that understands and tests function in these children, which I've been talking to you about for over 3 years, you're missing the boat. And now when you add in some amazing things like Dr. Spoelstra does, she talks about children doing a self-portrait. Can you go into that? Because here's the thing, self-portrait is one of the coolest things ever. And it is it's so much. And it floors parents, because when you look at self-portraits, they think it's a psychology test. And I tell them, no, it's your child's perception of their body inside their own environment, which is extremely important. So can we talk about this a little bit?
Yeah. I mean, it's one of the pieces
It
of
is.
I love that you're doing it. I always say it's one of the things that for some reason people are reluctant to add in. And I'm like, listen, I don't care if you're an optometrist, if you're a medical
Listen.
doctor, if you're an educator, if you're a chiropractor, you got to be doing a self-portrait, and you have to be not just taking a self-portrait, having a kid do a self-portrait, like color. We're talking about having a kid draw a self-portrait. And they don't have to be a great artist. It's not about that. We just want to see what comes out of the tip of their pen, like on that paper. One, how is it organized? How many body parts do they have? How big are their arms compared to their legs? And
Yeah.
what you'll find is it so often aligns with your clinical exam. So if you find that a child has, and there's a lot of complexity to this and interpreting this, and it's just a piece, it's a piece of the overall picture. But you'll find that, like, for example, like a kid who you find has gross motor challenges with, let's say, their lower body,
Mm-hmm.
um, and they stumble a lot, and they have vestibular issues, and they're having balance issues, and you see that on the quick little brain-based exam that we teach. Well, on their self-portrait, you'll see that their legs are either really, really small or not there. It's just like a head, right? And like little tiny, maybe something for feet. Or you'll see that maybe they have a perfect like head, body, arms, legs, but they're verbalizing it instead of visualizing it. So they've memorized it. So you'll find that a kid will be able to do a stick figure of themselves. But then if you say, well, can you draw of me? Can you draw a picture of me? It's the actual organic, like, oh, it's Dr. Amy's head and body and no legs, right?
Mm-hmm.
What you'll often find with kids with neurodevelopmental disorders or neurodeflective disorders is that they'll be, and at about 5, we really want to see all the body parts here, right? We want to see a head, we want to see a torso, we want to see arms and legs, we want to see that. Really before that, but really 5, if we're not seeing that. What you'll see so often with these kids that come in that have behavioral learning socialization challenges, they'll have like a head with like legs coming off of the head, and maybe like head and legs and arms or something. And you'll find on your re-exam that as you're seeing improvement with body awareness and proprioception and vestibular function, and they're having more awareness and more appropriate like connection outside of self socially, they're having more awareness of their body and space. Their self-portrait will all of a sudden grow body parts. Like, it's like, wow, it's a head and
It's
a
amazing.
body now. Yeah. Isn't it amazing?
It's crazy. And when you start looking at like what we do and learn the focus exam, and you guys, we talked about this for over 3 years in prime pediatric work that we do. A lot of this stuff that Dr. Amy has, this is smart stuff. And then it's taking what we've learned and understanding it. So case in point, I get kids in now, like now that I have them doing self-portraits, I'm wondering why the hell is this balance so off? And then I'm looking at their self-portrait and I'm like, they can't even perceive their damn foot. Like they've got a left foot drawn and they don't have a right foot, or they got a peg leg. Or what I noticed the other day, which is really cool, is I have a kid that's he's got gross motor and fine motor issues. His fine motor is horrible. His gross motor is decent. He's right-handed, draws himself. Left hand, fingers are perfect. All 5 are there. Right hand, they're like little blades coming out of, they're like just little specks. So like he can't follow fine motor with his right hand, yet he's right-handed. And I start correlating this with all the parents. Here's the thing though, guys, with this is when you start bringing this to a parent, it can be extremely overwhelming because this is the child they've had for 10 years that has always acted this way. And now all of a sudden you have a professional saying, actually, this isn't normal to see. This isn't okay. This is a change. They may not be ready for that. They may not be ready for that to hear, wait a second, there actually is something off with this neurology of my child, which I have thought for years, but now somebody's confirming it and I'm a little unprepared for it. Dr. Amy, how do you bridge that gap? Because I know you're really good at that, because chiros are notorious for fire hosing our patients.
Yes.
Because we just want to give them tons of information because we have all the information. Not that it's always right, like not all kids are gas pedals and brake pedals. All right. But how do you bridge the gap then when a parent's unprepared to hear what they actually brought you the child to hear?
Yeah, that is a really important point. And that's why we actually have a significant amount of our curriculum about creating a safe place in both your office environment, your procedures, and your communication with parents, because it's not enough to just understand the clinical presentation developmentally and neurologically of the patient, of the kid. If let's say it's a kid in this case, it's also really just as important to understand the neurology of the decision maker, of the parent, of the caretaker, of the spouse, whoever it is that's making the decision and who makes up the support team. You have to understand what it's like to be a parent, yes, living in chronic stress, how they make decisions, what type of communication to have with them, what type of how to present financials with them, how to do appointment scheduling with them. It's different. People in chronic stress, they make decisions, they learn differently. We know that. So that's really important. And then respecting, you know, where they are and understanding like what you said there. We don't want to make them wrong. And so often we make them wrong, and or by presenting passionately the things that we have found that we're like, hey, we can help you with this. What they're often hearing is there's something wrong with my kid.
Yep.
Even though
Broken.
you nailed it, they've known that
Mm-hmm.
innately, and they've been seeking help and not getting the confirmation and the action plan for years. This is commonly the case, especially with undiagnosed kids who are having challenges with behavioral learning, socialization challenges, but maybe don't fit into a box of a diagnosis, which is many of the kids that we see. My heart really breaks for those kids because they're flying under the radar. So they look like, and they really are pegged as a bad kid or a bad parent or whatever. The parents saying, I know my kid's not bad. I know my kid's smart. There's something else. And then they come to you and you're like, yes, there is something else. But we have to be very strategic and careful in how we communicate that something else, and that it's, hey, I'm not saying your kid's bad. I'm saying that we can improve their expression of life by doing these specific things and monitoring change. And the concept we use for that, which really guides communication and clinical assessment, is the two big questions. You know, we just say, listen, I know, I agree with you, mom, your kid's not bad, but I do also see that she's having big meltdowns after school every day. And, you know, I just want you to know, I know she's not bad. I know it's not you as a parent. I know that that's a window into her brain. And that's a window telling me that she is not using the most sophisticated tools that she maybe could be to bring to this dance of life. And therefore she's having these deflective challenges. So here's what we need to do. The way I can know if I can help you is to just ask and answer two questions. The first being, you know, what's going on with her brain and communication to and from her brain? Because if that's off, it's going to impact, you know, the way she's moving through development and the tools she's using, which is going to change, you know, the way she's engaging with life and can cause some of these challenges. And the second question is, let's do the brain-based exam to see, you know, what tools is she using? That's where we bring in primitive reflexes, gross motor, fine motor, auditory, verbal, eye movements, etc. And then we just say, let's just ask and answer those two questions. And then on the report of findings, we just say, hey, we asked and answered those two questions. Here's what we found. Here's our next step. And we're just going to watch your child, have improvement in the way she processes her world. And that's what we're going to do. So it doesn't make them wrong for everything they've done before they've come to you. And it doesn't make their kid bad, but it does give them the appropriate information and the next action step.
Exactly. And I absolutely love this. And this has been completely kick butt. Now I'm going to push back on you real quick.
Mm-hmm.
There's been a few people that I've talked to that say that, you know, Dr. Spoelstra, all she does is PT. I don't think that she really adjusts anymore. I don't think that she tries to clear the nervous system. And what do you do there? Because I know you, but there are a lot of people that would say, well, focus program is all about just therapies. So what is it really about then?
Well, the funny thing is, just this week, I had somebody who joined our focus program, really principled chiropractor, which so am I, by the way, just spoke at Lyceum, speaking at Scotland. I'm a pretty principled chiropractor. I also speak in the functional neurology circles. But I think that's great because it's really about making the case for a clear nervous system. Yeah. And I kind of go between the two because of my background in neurooptometry before I became a chiropractor. But I think the science makes the case for chiropractic. And so that's really everything I do. But the thing is, so I had this chiropractor recently join our what we call lead access program. And he said to me, he messaged me and he said, oh my gosh, I'm from a really principled camp. And I was really resistant to joining your program because I thought, like, he's like, I want to stay, me and my friends, we were always like, oh, I don't know, because I want to stay principled in chiropractic. And he goes, well, I joined your program. He goes, everything I'm learning is 1,000% about principled chiropractic, and then knowing when to add some other things in addition to, but making principled chiropractic the foundation of everything. He goes, I wish I would have known this before. And I was like, yeah, I mean, glad you know it now.
That's what it is. And then
so what I do is the foundation of everything. I mean, we are even clear in the doctors we train and in our actual offices, you know, in our brick and mortar practice, we even have a separate waiting room for the other things that we do that are not chiropractic. It is very clear this is chiropractic. You cannot do any of the other things, access any of the brain-based support without being under chiropractic care. No. So, you know,
it's not effective. It's not as effective.
Yeah.
Unless you have a free and functioning nervous system that can completely communicate, it's not effective, because all we're doing is we're just essentially reprogramming within a malfunctioning paradigm, which doesn't work.
That's right. Just today, I was on a clinical call. I do these kind of clinical roundtables with optometrists sometimes. And I had this call with this guy's out in the Midwest, and I'm on this call, and they're doing all this really great neurooptometry work. And we're bringing in some polyvagal theory stuff, and they're doing all this stuff for this guy. And I was like, got to my turn, and I'm like, I mean, he's getting adjusted too. The guy's brother's a chiropractor, but he's not getting adjusted. You know, he's not getting clear. And I was like, I mean, my contribution is here, like all that other stuff is great, but if you don't do this, yeah, I mean, you're kind of just creating a big old mess. And so we're getting him to a really good chiropractor. In this case, an upper cervical chiropractor, because that's what he needs. And I was like, that's my contribution. We could talk about all this other stuff with the eye movements. That's all great. But I think you're making more of a mess if you don't clean up those cervical afferents first.
Yeah. Clear out the irritation. I love it. I absolutely love this. Dr. Spoelstra, you are absolutely amazing. Where is the best spot for my listeners to get a hold of you? Obviously with Focus, but what is the best ways for them to find you? Because if they don't find you after this talk, they're not going to find you. So how do they?
Let's see. So we have our certification series. I don't know when this is airing, but we have our certification series open right now. Our next live training and group getting certified is in August 12th and 13th in Coeur d'Alene, Idaho. There's some online prerequisite learning that you get instant access to before that. We have, for the whole thing, we have about 10 spots left. We have 5 more left at the promo offering, which is going to be done this week or next week. So I don't know when this is airing. This right now is May 4th, but so gofocusacademy.com is the website, and the code is all caps focus now, if this airs in time. If not, you can hit us up at gofocusacademy.com. We also have a free group on Facebook, which I'm sure Skip can send out a info to, but that's where we live.
I'll hot link you on everything. Trust me. And yeah, this will be aired before August. We'll get this out there. It needs to be. Dr. Spoelstra, thank you so much for coming on. Amy, and you are a close, dear personal friend of mine, and this has been an absolute honor. I know you on a personal level, and I know you on a professional level, and it's just been great. Thank you so much for the honor of being on here with me, and have an awesome, awesome day, Dr. Spoelstra.
Thank you. You keep up the good work. You're doing amazing work in the pediatric world. I appreciate you, and thanks for having me on.
Thank you, Dr. Amy. All right, everybody, now go out there and get it done. Take care, everyone.